Unlock the secrets, learn new tactics, and build a winning strategy to win the aging game. Welcome to the Aging Game with Bruce and Susan.
Welcome to Season 2 of the Aging Game with Bruce and Susan. Today, I'm excited to kick off our official second season. And our topic today is going to be unlocking the benefits of in-home care. And I'm super excited. Our special guest is Adam Corcoran. So I'm excited to introduce him to our listeners and dive into that later.
Great to be here, Susan. Nice to see you. Nice to see you, Adam. It's so exciting starting season 2. And I know we have an all-star lineup with season 2. So we have just wonderful guests that we're going to have presenting throughout this whole next season. And we're kicking off with Adam, which is a good friend of mine. I've known Adam for 20-something years.
That's right.
And so we've been on boards together. We've worked together. We've referred business back and forth with one another. So it's great to have Adam here. So, we're going to try something different with season 2 based on some of the feedback that we got. So we're getting questions from our listeners, which is very exciting. So keep those coming. And so we're going to start this off by trying to answer the questions that we get. So
exactly. So I think one of the things that was really shocking from last season was the amount of questions and the engagement we got in season 1, just bringing this out of nowhere. It was great to have that engagement. So each episode, we're going to take a question from the prior episode and, answer that, whether that's a question that came in or a theme of questions that we saw across a bunch. So we're really excited to kind of change that up and help our first segment, really get to those questions you guys have. So today, let's start with it. As I was going through and reading all of the questions and the comments we got from season 1, one of the recurring themes that really jumped off the page at me was people just asking, like, how do I start this conversation? Or how do I navigate it when someone is resistant or maybe a little in denial? And I thought, we're really helping giving all that information, helping make a great plan for the future. But let's back up a step and how do we help them start that conversation?
Well, how much time do I have? Because,
right,
because
forever.
that topic and that question could be a long answer, but I'll try to narrow it down the best I can. And one, I would say it's important to notice warning signs, and so everyone has a baseline, and so if your mom or your dad or your spouse, everybody has a basic baseline. But when things start to decline and you start seeing changes of that baseline, those are the warning signs. And so if you start seeing a decline in cognitive ability or in physical ability, or you start seeing old food in the refrigerator, well, the baseline's different now. And so those are some of the warning signs that you have to notice. I have this life lesson, and I think it's relevant, in that your desire to change must be greater than your desire to stay the same. Mm-hmm. And if you start, so I'll say that again: your desire to change must be greater than your desire to stay the same. And you start thinking about that in life. If you're working out, your desire to change is greater than your desire to stay the same. Or if you're trying, a new diet or whatever. So when you start thinking about, having the talk and talking to your folks about, all this, well, that desire to change has to be greater, or people are going to stay where they are. I always say there's a million excuses that people find, and if you look hard enough, there's always excuses about why you shouldn't be doing something, but you really need to start thinking about all the reasons why you should be doing something. So that's important to think about. In previous episodes, we talked about caregiver burnout, and over 60% of caregivers burn out. And it's probably much greater than that percentage, but that's a really interesting, when you start thinking about, a spouse or an adult child taking care of their children and they're going to experience burnout. Well, you want to protect that. And so that's another reason to have the talk. I think there are times where people have cognitive decline, and they're expecting that person to make the same decisions as they've always made. And we call this, executive functioning, and that's one of the first things that decline when someone is in cognitive impairment. And so, executive functioning is that ability to make a decision and that ability to think logically. And, this is very difficult because you want somebody to make that logical decision, but they're not capable of making it. And so, that is, we have to recognize that individual may not be able to basically connect the dots and make that logical decision. I'm giving you all a lot of information in a
love
short
it.
period
Keep
of time.
going.
So, and I, how do you have the talk? And this is not the talk that we think about, but how do you have that talk? And and I think, you got to start early in the process. And the main theme of our podcast is to prepare and plan ahead. So you got to start early in the process. You got to get family involved. And, sometimes that's easy. Sometimes that's hard. Sometimes family members are all on the same page. Sometimes they're not. But you got to get your family involved. I think when you're talking to somebody and having the talk, trying to make I statements, make it personal. Like, honey, we need to move because this is just too much for me. Honey,
Right.
we need to make this decision because, it's wearing me down. And so when you make it personal and not make it about the individual, and you make it personal, make it more I statements, I think that's something important to think about. Sometimes it's important to bring in an expert, have an independent third party, have an advisor come in to sit down, because sometimes that third party can say things that, maybe it's just too sensitive to talk about. Moving, if that's the talk, to moving into a memory care or to moving into assisted living, you can make it fun. You can go to
right.
rooms to go, and you can buy, you can make it fun. And so, it doesn't have to be, the end of worlds. You can make it a fun experience. For people who are having a hard time even thinking about the transition, think about the past, about maybe they moved before, and kind of bring up that memory about, hey, honey, we moved, remember when I was, got this new job, we had to move across the country. If you can kind of bring those memories in, I think that's helpful. And sometimes you have to bring home care in, to try it out. So I think that's a really good answer at first, to try home care. Just to, again, you want to avoid the caregiver burnout. So trying to bring home care in to lessen the burden on that individual. Many of the communities offer respite, which is short-term care, and that's another good answer. Again, you got to you're trying to take care of the caregiver, and so maybe that caregiver needs to take a weekend at a spa somewhere, and so going to a respite facility, might be a good answer. And then the third or the last thing I just got to say to all this is that, sometimes you just got to rip off the Band-Aid. And,
Right.
it might
Right.
sting a little bit, but sometimes you just got to do that and make that decision. So, those are some good tips, I think. And, I know I covered a lot in a short period of time, and I
Yeah.
could talk a lot about each one of these, but something to think about.
I think that you said a lot of wonderful things. I think the thing that jumped out at me is, I think when people are thinking about these situations and challenges, they're thinking about, it's either my spouse that's declining or my parent or whatnot. And we're kind of forgetting to talk about that caregiver. So the other spouse that maybe isn't having the decline, what is the burden on them? What is the stress they're having every day? And I think that was really a key point there for you of, make it about, not the person that's having the ailment, but the caregiver or me, and those personal comments. This is what it's doing to me. Because I think when you share that, that could be eye-opening to whoever is participating in the conversation.
It must be very, I'm sure it is. And we see it about the caregiver and about, somebody who is, they've been married for 50, 60 years and their spouse is declining and they don't know what to do. And, who knows with sundowners, when it happens in the evening and the stress that becomes. And, there's probably some, alcohol abuse and all those
All
things. There could
sorts.
be verbal abuse, there could be physical abuse, and all those things, impact someone's
Mhm.
quality of life and affects their immune system, affects their well-being. So it's important to think about that.
It really is. I think that was phenomenal information to answer a ton of questions that have come in on that topic. So thank you so much for all of that. One thing that we do want to keep the same this season in this segment is your good old story and my good old stats. So I know you've got a story for us today.
So my story, since our topic is home care, so my story involves home care, and I had a client, lives in Gulf Shore Boulevard, and this is during Hurricane Ian, and so she lived on the 10th or 12th floor of this high rise in Gulf Shore Boulevard, and her elevator shaft got flooded and lost power, and didn't have power, didn't have food, didn't couldn't get out, and she had a caregiver, and this caregiver went up the stairs every day and probably multiple times throughout the day, and brought her food, brought her helped her change of clothes, helped her entertained her, and just kept her involved. And you know we you don't really think about the unsung heroes of when we have hurricanes and things like that. And this caregiver truly was, and this caregiver pulled her through a very difficult time. She couldn't, this woman was in a wheelchair, so she couldn't leave the building. And this caregiver left her family at home and provided this care. And so you know I think that's what it's all about.
It really is. I think for season 3 we need to have a hurricane episode. There's so many stories. You're right. That's a beautiful story and a great example. But how many of those do we see? When there are disasters like that, and I think the caregivers don't get the recognition that they should, because they really are the ones that get them through. There were a lot of people during Ian that I think would have just given up, but if it wasn't for their caregiver that came in, and those connections are important. So thank you for sharing.
And you think about they have families at home, and
Oh,
they're leaving their families at home, and
yeah.
their husband or their wife and their kids and their
Dogs.
their dogs. Yeah, and so they're looking after the people, and
Absolutely.
so the caregivers become an extension of someone's family.
They really do. I think that's a great story to start off this topic of home care today. So thinking about stats, I read a couple for today's episode, and I only want to share one. I'm going to share the second stat I have next week. But I was reading a Home Care Association of America study that they had done recently, and they said 70% of adults over 65 in their life are going to need assistance with activities of daily living, so your ADLs. 40% of adults over 65 will require daily help with the ADLs. And I just thought, wow, if that doesn't really put it into perspective for you, that this topic is important, that we do need to have people have these conversations, the numbers are just not in our favor. I mean, basically, all 3 of us are going to need help. Some of us,
Right.
I'll be the one here that'll need it daily, just so you guys are cool. Don't stress there. But yeah, I mean, shocking numbers, I think.
Well,
Validates what we know in our industry, but I would say shocking to the person who doesn't know about our industry or isn't in this every day.
and it's when you start thinking about that, and to our listeners, I'm 6'7", and my wife can't help me, and so she's not six, so if I fell on the ground, she doesn't have the strength to pick me up off the ground.
Yeah.
And so that's a fact.
Yeah. It's when I put the stats together for each episode, I'm always reading them, and they're things I know. They're things I
Right.
read all the time. I hear about. I see them every day in the industry. But I try to pick the one that I think is the most relevant to the topic, and the one that would probably shock our listeners the most, because I think that's really the point here, is that I think a lot of people are in denial, or it'll happen later, or that's, I'm 30, so I don't need to worry about that, or whatever. But no, this is the reality, and these are the numbers based on today. We know every day the amount of people turning 65 is astronomical, and the cost of care nationwide through many different programs, Medicare, just to care for someone with an ailment is growing. So we need to start these conversations, pull back these onion layers, and remove the stigma. Have this be an okay conversation to have with your buddy over a beer.
That's what we do.
Yeah. All right. I know you've got a quote for me today.
So the quote is, the most powerful weapon in chess is your next move. And so, what's the meaning behind that? And it just goes back to the whole thought of our podcast, planning ahead. You got to have a strategy. You got to plan ahead. Hope is not a strategy, and so
right.
you gotta plan ahead, and so you gotta your next move. If you don't have a next move, you don't have a next move.
Mm-hmm.
So
Yeah, I think it's key. Just knowing what you're going to do next. Like I think I closed out last season with asking, if you fell today or had a major medical change in condition, what would you do? Are you ready for that, or do you need to take action? So I think that's a great quote to kind of set us off on this season. So we're going to take a quick break here from one of our sponsors, and then we are going to dive into it today with Adam.
sounds great.
All right.
Bright Star Care of Naples and Fort Myers, providing exceptional in-home care. At Bright Star Care of Naples and Fort Myers, we believe that you and your loved ones deserve nothing but the best. Our team of highly trained nurses and caregivers are committed to delivering the highest standard of in-home care. We offer a wide range of both medical and non-medical services to cater to your specific needs. From companion care and personal care to skilled nursing and therapy services, our professional care team is here to meet your needs, both now and in the future. Bright Star Care is proud to provide the highest quality of care and prioritize in-home safety. We are accredited by the Joint Commission, and all care is overseen by a registered nurse. With Bright Star Care, you can have peace of mind knowing that your loved one is in the best hands. To learn more about Bright Star Care of Naples and Fort Myers, visit us online at brightstarcare.com or give us a call at 239-992-4779. We are available 24/7 to answer any questions you may have. Bright Star Care of Naples and Fort Myers, where exceptional care meets compassion. Locally owned and operated since 2006.
Welcome to the Gambit. So today I'm super excited. We're going to dive into my personal favorite topic, in-home care. And today we have Adam Corcoran.
Well, welcome, Adam. It's great to see you. Glad you're here. As I said, Adam and we've known each other for many, many years and worked very closely together. And Adam is a dedicated entrepreneur and founder of Elevation Marketing, which is a full-service print, promotional products and apparel company.
That's right.
So, and I see you got a nice shirt on with Elevation Marketing.
That's right.
And so I know you've been doing that, but prior to that, you were in the home healthcare business for quite a while, and so that's why you're here, is to talk about home healthcare.
That's right.
Yeah.
So it's great to have you.
Yeah, when we were talking about topics for this season, I felt it was really important to, drill down deeper to some of the things we touched on last season, and in-home care, senior living communities. Both of these were things that we had talked about many times through the episodes. And, obviously I'm in the in-home care industry. I run my own company, but, I desire for this to be a great space where people are getting the best information out there. And, professionally, I grew up in this industry in Southwest Florida, and you were always, I guess, a competitor, but always someone that I looked up to and admired and really respected. I knew that your reputation was true, your passion, and those were things. So when we were thinking about talking about this topic today, really for me, it was a no-brainer that it was you. If we're going to talk about a topic that's near and dear to my heart and I work in, I want the best of the best. And for 11 and a half years, you're always someone that I've really respected. When I heard you were leaving in-home care or whatnot to do Elevation, I remember distinctly the first person who told me, and I was like, no, I think you misunderstood. Like, I think that's a side hustle for him. Like, he is in-home care. Like, right. In-home care is Adam. Like, he can't not be in it. But I've gotten to know you more over recent months through some other, avenues and stuff. And I'm so excited for everything you're doing with your company. I love that you still have a great connection in the in-home care industry. And I'm so excited to dive into this topic today, pick your brain with you, and share all that great, knowledge with our listeners. So thank you so much.
Of course, I appreciate the opportunity, and right back at you. I've always had so much respect for you and what you do.
Oh,
It's
gosh.
great being in a room with great people.
Isn't it? We sit in here every week, and I'm in awe at the people that come to the table and give us the time. It's really remarkable. Our community does care so much about our seniors. All right. So before we get started into the meat and potatoes of the episode, I love to ask my same question to everybody. So what is something you know today about in-home care that you wish you knew earlier in your career?
I thought about this question quite a bit, and it really just boils down to is I'm shocked of people's lack of planning. Like you talk about the statistic, 70% of people over the age of 65 are going to need some type of long-term care, which over the span of 3 years, the average is 3 years. And we get to this situation where you're meeting with families and you're meeting with people and spouses, and there's no plan in place. So being in the home care space for over a decade, going to these situations and people really operating in crisis matter and not having a plan was very interesting to me. And it put perspective into my own life, like my own family, making sure I have advanced directives even at the age of 35, and having a will and having those the power of attorneys and those situations, and having a plan and having open conversation with family of understanding like what our wishes are, even at the age of, mid 30s. The reality is, especially when it comes to home care or moving into making a transition to senior living is usually it's not buttoned up. It's usually, a situation happens and then something, goes into a crisis matter. So I think that's what kind of alarmed me the most is like, I have to take these scenarios and I have to look at our situation, our family, our parents. These are situations that we really should be having all the time to make sure that everyone's on the same page, and things change, right? So as these things change, continuously having these conversations, just so you're setting expectations across the board with all family members.
Yeah, I think when I got into this industry, I was 30. And I remember thinking, long-term care insurance, I don't need that at
Right.
30. Home care, come on, what's that? And I learned very quickly, like, no, these are things, and it doesn't matter your age. You do need to think about this. And then, at any point, like, I guess it's never too late to start the plan. But my gosh, I think it's just a topic that people, I don't know, think it's later in life and I'll deal with it then. But you're right. It's that crisis mode, and that's what we see all the time. And, it's so overwhelming. It's shocking.
Right.
So
It is.
and what going back in time, what led you into the home healthcare business?
It's interesting. I grew up in this world, actually, and a lot of people don't know that about me. Is my mom was a home health administrator all my entire life growing up. So I remember, gosh, early on in my life, being 10, 12, 15 years old, and having caregivers at the dinner table. When mom had to run out and do a nursing assessment, I was in the car as a little kid, right? So it really comes back to kind of the foundation of my mom caring for other people, and how, she built such a career that was so rewarding. When I graduated college, I taught school for a couple of years. I spent a couple of years in corporate insurance sales, marketing. And then I had a long conversation with my mom about what my next move was. And she said, well, why wouldn't you get into something fulfilling like home care? And I said, well, I'm not a nurse. And she goes, well, home care companies need marketing people too. And that's when I dove in, and, you learn a lot in college, right? We understand that you can learn a lot by experience, but there's something to be said about growing up in an environment. In the summers, I would be in my mom's office stuffing folders or, doing like simple admin tasks, being surrounded by that, and then fast forward 20 years later, doing it as a career was something special.
Well,
I love that. I think it's worth noting that I think that must be in your family blood because your children are here. And I
That's right.
wonder in 20 years, one day when they're in their professional careers, what you're instilling in them, being able to see what you do as a professional and the difference you make. Like you're creating the next generation of professionals there.
That's
And
right.
that's really remarkable. And you grew up in that and they're growing up in your business.
Yeah.
That's
And like
beautiful.
20 years ago, I never thought in a million years I would be going into the home care world. And then once I did, it really triggered like how special, caring for seniors really is.
It really is. Wow.
So let's kind of dig, like, kind of peel away the onion on home care, because there's a lot of confusion about the different types of home care, between personal care, registry, and agency. So, let's break it down for our listeners so they fully understand the differences, the pros and cons of each.
Right. Yeah. So, I mean, there's definitely a lot of different options when it comes to hiring in-home care support. Typically, you're going to see the care professional going to be a certified nursing assistant or a home health aide or a companion. So those are like the three levels that you would most likely see. In the state of Florida, it's important to understand that a companion company cannot provide hands-on care, right? So they can come in, help out with like housekeeping and meal preparation, transportation to doctor's appointments. But a company that only does companion care cannot physically touch that person. So that's kind of like the most basic level of in-home care support.
And is that advertised as companion care?
Yeah, it's tricky because I'll be quite honest. I always had the opinion that a companion company is really not serving its full purpose, because and Susan, you know this just as well as I do, is 9 times out of 10, if not more, anyone who picks up the phone and needs some level of care at some point is going to benefit from having hands-on support with helping with ambulation, helping getting in and out of a car and out of the shower. So, I found out very quickly that, in my experience, that we weren't going to hire just companions for our company because we know the risks associated to not being able to provide hands-on support. So are companies out there forthcoming about what they can and cannot do? I would just be very cautious to read between the lines because, I have seen advertisements that allude to that the company can provide like standby assistance or, monitoring when in a shower. You have to really ask specific questions and understand what that care professional, that caregiver can and cannot do when you're hiring someone.
So that's the first level.
Right.
So,
right.
Is that, like, if I just hired somebody from Publix, is that, how would you define that person?
Yeah. So, and we saw this a lot in our world is, from an affordability perspective, families or, spouses felt that they can go source out their own caregiver. And, there's certain risks associated to that, right? Finding the checkout girl at Publix, who might be the sweetest person, just truthfully doesn't have the skill set, that you need to have someone coming into the home. The other risks associated to hiring someone private without an agency or a reputable company is the liability of bringing someone in with no contract, no insurance. There's no protection on workers' comp or any bond for theft or anything like that. So, when a family member takes on that responsibility to source out a care professional, it's a huge burden. And the reality is there's so many things that go into, developing a home care agency that, at that point in a family or spouse's life, they really don't want to take on that burden. And what ends up happening is they end up hiring someone just because they have a perception of their being a sweet and kind person. and then things change, right? They either realize that that person doesn't have the skills that's required to come and help their mom or dad, or we know the alternative, like a lot of other stuff can happen,
Or what
including
happens when the person doesn't show up
right,
or doesn't
Yeah.
feel well, and so now
right.
you're really up a creek.
That's right.
I
That's
So
right.
think one thing worth noting is I think when people go and hire privately, it's they look at the person, whether it's I see it all the time. Publix is honestly like this is a great example because
Right.
it does happen. They meet the checkout girl, they see
It
her every Thursday,
happens.
right? And you have this perception that yes, they are sweet, they are kind, they can do this, and they're making also this other judgment about skill set. Like I'm sure they can help me in the shower. They're bigger than me, or they look stronger, or I'm sure that they can help me walk around my apartment or whatever. But I think about it too as well, like caring for someone with a cognitive impairment, it is so different. How you engage with them, how you redirect them, that's all different. And that's not something you pick up off the street. That's
Right.
something that you get through training and experience. And I think that's really what people have to consider too is what is that training they have for those interactions in that conversation. I don't want you to yell at my mother or my spouse, but you're going to get frustrated, but you don't have the tools in your toolkit to know that.
it's a good point.
Right.
Yeah, it's
It's a good point.
it's
And-
scary.
And
So,
like you
and-
said, like things change. So it comes back to is that person suited and has the tools and resources to be successful on a long-term basis.
So yes, might be less money per hour. It might be convenient. You might live down the street, but in the long run, you're
Yeah.
asking for trouble.
And I think families really have to map out the whole scenario and look at the risks associated to it and understand why it's beneficial to go with a state certified home health agency or even nurse registry for that model. And just to touch on the differences, in a home health agency model, a home health agency is responsible for employing that certified nursing assistant or home health aide, whereas a nurse registry model is also licensed by the state of Florida, but their contractual agreement to the care provider is actually a 1099. So they're an independent contractor model, whereas, it would be to the care provider to obtain their own insurance and make sure that they, have that. They might still be certified, but they're just not certified through that agency. They're an independent contractor for that model.
So just to go over that one more time. So a registry, the people working for the registry or they're working with the registry are not actually their employees.
Correct.
They're private contractors.
Yep.
And compared to an agency, the folks who work for an agency are actual employees of that organization.
That's right. Right. So a home health agency would be responsible for monitoring the level of care, creating that care plan, and making sure that their employees are staying true to the expectations of what the family has, and having complete oversight of that. And like you said earlier about having coverage, like God forbid a caregiver doesn't show up, home health agency is responsible for finding coverage in a reasonable amount of time. They're there as your backbone to be able to make sure that the care gets seen all the way through. Whereas, and it's more commonly now referred to as like a referral agency or referral company, the nurse registry model. I've seen that more commonly recently, which is encouraging to be transparent about the relationship of a nurse registry and their independent contractors and how they're providing care for those families.
So just one last thing. So when you look at like advertisements of a registry or an agency, sometimes it's not easy to distinguish between the two. So
right.
What can our listeners do to figure that out?
Yeah. So here in the state of Florida, it's actually it's great because to advertise your services here in the state of Florida, whether a brochure, flyer, your website, you must list your home health agency license number on those materials or website. Anything that describes the services that you're providing has to have your agency license number. So if you're looking for a home health agency that employs their caregivers, you're going to find a number that starts with 299, and then I think it's an 8-digit number. Whereas a nurse registry license is still licensed by the state of Florida, and their license numbers start with 302. Companion companies start with 203. I know there is some variations, but those are the most common license numbers. So that is something that you definitely should be looking out for. Now, I'll be very honest with you. I've seen a lot of literature in my time, and now being in the world that I'm in printing, I see more of it. I'm alarmed at how many people fail to put their license numbers even on their literature. So that would be a kind of a red flag for me off the bat, because if they're not staying compliant with the regulations of having to put their license number on their materials, it would lead to bigger questions for me.
I think on this topic, what I've started telling people to do, because I've noticed that the license number is not on everything. And I mean, it's definitely changed back in, the day they would definitely try to advertise as agencies. It's definitely this referral model. You're starting to hear those words more. I started telling people, when you do your research and you go to any company's website, click on the employer part. Click what it's like to be hired there. So I had demonstrated this for a client I was meeting with recently, because they were very adamant that the company they were working with was an agency, and I knew absolutely they were not. Now, when you went to their website and you looked at their services, it wasn't black and white. It wasn't crystal clear. And I said, do me a favor, click on the for employees part and see what that is. And it was a very clear distinction. I mean, the way it was being sold to the employees, it was black and white clear at that point that it was a different model. And I said, so this is where you have to educate yourself and be your own advocate. I think it's important to, when you're doing your research, to look deeper into it. I don't want to say like don't trust people, but like you have to validate for things for yourself. And I think that's a great little tip to get the perspective of what the employee support is or what they have to really help. I think that was a great idea.
Do you feel that it's mostly money driven, that someone picks a registry over an agency because they're less expensive, or do you think there's another reason behind that?
Yeah, if you were to ask me 10 years ago, I would say 100% common, a nurse registry model would be more affordable than a home health agency. No doubt. 10 years ago, I would put money on it. Nowadays, we're not seeing much of a difference. And I don't know if it's for the pure fact of kind of that concept of if it's too good to be true, right? Like if it's too cheap, then really is it? I think, home care in general the costs have significantly increased over the past 5-10 years, right? We understand that. But I think it's kind of like, you look at the industry and it's like across the board, we're, in the mid to low 30s per hour, and you're not seeing much of a difference anymore. So, I mean, to be quite honest with you, I don't think, there's different models and some models work more for one person than the other. But when price was such a huge factor back 5-10 years ago, you can understand why you go one with the other. And now I don't see a difference.
Interesting.
The
Now, when
spread was obvious. I mean, you would have a phone call and someone would say to you, what are you paying right now? And they would say X, and you wouldn't even need the company name. No. You would know you're with a registry.
And I think over time, nurse registry models understood that the cost difference was so significant that they kind of all leveled out. And I don't know if that was intentional to mimic the model of a home health agency, home care agency. But yeah, we're not seeing much of a difference. Now, when it comes to private caregivers, again, that's where you run into the bigger problem, because, that caregiver that you're finding at Publix or wherever, is probably willing to do something for a lot less. But again, there's just so many risks associated to that. And going back to what you said, Susan, like the doing your due diligence is just so important. Like, guys, we're not like picking paper towels at the grocery store. Like, this is a real situation. You're inviting someone into your home or your parents' home or your spouse's home to care for you, your well-being, making sure that you're safe and you're taken care of, your nutrition is taken care of, all aspects of this aging game, you should be doing your due diligence, and that's why I encourage, and I know you guys said this over and over again, is planning for the future. Because again, when you're operating in that crisis matter and you're calling the first three companies and whoever's the cheapest is that's where you're going to go, I could tell you right now that you're not making an informed decision.
No, it's tough. I mean, it really is.
No.
I think the next kind of part that goes into it is we've talked about like the companion personal care kind of model, but where do you think the factor comes in of like skilled versus a non-skilled company?
Yeah, it's interesting. I mean, if I had $1 for every time that I would get called on a weekly basis and someone says, well, what do you mean? Medicare doesn't cover this? So it was a big education, opportunity for, us as a home care agency to educate the families and or clients themselves that there's two different types of care when it comes to in-home care. And in Florida, we really do a good job of distinguishing home care services are considered to be non-medical. Your light housekeeping, you're helping with showers, transportation, helping with ambulation. But then the term home health is more so associated to your medical care at home that is covered by Medicare. So that would include like support with nursing, physical therapy, occupational therapy, speech, some limited home health aid support. And when I say limited, I say that with good intention because, Medicare might cover a home health aid to come and help with a shower once a week, but that's it. I mean, and nowadays you're seeing Medicare pulling back on a lot of the services, to be very honest. So, but it's important to understand the difference. So when, here in Florida, we hear home care, we think of it from a non-medical perspective. And when you hear home health, it's more on the lines of that clinical support, doctor ordered, usually after a hospitalization or a rehab stay, you're going to see those clinicians come in and support.
Can't imagine one shower a week.
No, gosh, right? No, that's crazy. Thinking about in the home care, space, things like medication management. That's, I think, an important thing. We know medication in general is just a hot topic right now. It's the cause of a lot of things. Where do you see that medication management falls in that home care space?
Yeah, and it's interesting because the companies that are doing it right work within compliance of regulation, right? So, and the regulation states that medication management is not to be done with a home health aide or a certified nursing assistant. And trust me, you don't want someone who does not know medications to be filling your mom or dad's pill box. You just don't. You want someone who's qualified, LPN, RN, coming in and having that oversight, making sure, and the fact of the matter is so many people are seeing so many different doctors, and they're going out to a hospital, and the hospital doesn't know what medications you're already taking, right? So sometimes after hospitalization, they're getting prescribed medications that, none of the clinicians are talking, so that becomes very difficult. So you're going to want someone who's qualified to come in and take a look at what's going on with all the pills in the house, all the, containers to make sure that it's done and you have no medications that are really impacting that person. I think medication is a big thing.
Is there a national organization that oversees all the home health care agencies?
Yeah, here in Florida, it's a term that we call ACA, right? And the ACA is the governing agency that oversees home health, home care, even assisted living. That's where our licensures come into play.
ACA meaning the Agency for Healthcare Administration.
Mm-hmm. Yep.
Okay.
That's right. So yeah, they're the governing body who has these regulations in place. So, when it comes down to medication, they're very strict on who can and cannot provide oversight on that medication. And there's a fine line because a home health aide or CNA can help support with self-administration, but there's a fine line in the sand of what they can and cannot do.
Mm.
So
It's
what
scary.
is it? Janko or the
Oh, Joint Commission.
the
Joint Commission.
Can we talk a little bit about that?
ACHC is another one. Those are just additional accrediting organizations. It's not required by any home care agency to get accredited through those organizations. In my opinion, it's a good thing to do. It's holding yourself a little bit more accountable to the certain regulations and making sure that your policies and procedures are up to date and timely. And there's something to be said that if you're accredited through one of those two organizations, ACA doesn't come for surveys as often because they know that agency is doing it correctly.
Yeah, you're defaulted. Like we have Joint Commission, so
Good.
ACA would only come if there was ever a complaint issue to us.
That's right.
And they just drill down, and you have a higher standard to safety and quality. I
That's
think
right.
that those are definitely worth talking about.
Good to know.
Yeah.
Yeah. So I want to kind of shift into thinking about like the caregiver.
Mhm.
So that CNA or that home health aide, that match is so important. I think if that's not a successful match, then it's not a successful experience. So in your time, how would you ensure a great match? What would you encourage our listeners to do around that?
It's so important that initial intake assessment, living room visit, different companies call it different things, but is so thorough, right? And because there's so much that goes into 24 hours in a senior's day, right? And understanding a day in their life and understanding all these things. So, when we used to go in and kind of do a day in the life of that person who's now going to be receiving some sort of care, I mean, it would take probably 2 hours, an hour and a half to 2 hours to really go through all of the steps. And it's so important to be intentional when you're doing that assessment because, right, the caregiver match is so important. You said earlier, caring for someone with cognitive related diseases like dementia, Alzheimer's, it takes a special person to be able to care for someone at that level.
Mm.
Now, if you have an employee roster of, only a fraction of those people are familiar or trained or have the tools and resources to be successful in that environment, you need to make sure that those two things come together. It's almost counterproductive to put a caregiver into a home that doesn't have the right skill set. So, like, let's just take, for instance, you have a client that needs severe support with ambulation and getting in and out of a shower, but then you send in a caregiver that doesn't have skills to be able to help with those transfers and ambulation support, then that, that task isn't happening, right? I mean, that's just the nature of it. So it's almost like, then why have it if the caregiver that you're bringing into the home doesn't meet my needs? So that match is so important from a skills perspective, but then also like when it comes to, talking about socialization and life enrichment and truly understanding who that care recipient is, right? What are the things that they like to do? I remember, gosh, years and years and years, we heard families saying, well, mom can't bake anymore. She used to bake. She loved to bake, but she can't bake anymore. And I said, you're painting a scenario of mom who doesn't have support. Now that she has support coming to the home, what are her her wishes? What are the things that she can get back to doing? The idea of bringing home care into this space is to be able to preserve independence and bring out, people into the things that they really like to do. So, but with all that being said, it's important to find caregivers that have, similar interests, or at least going to help, those clients get to, the place that they really need to be.
It's so important, because, we talk a lot about care and, help in the shower, help with med management, help with all that. But then you start, you have a caregiver who's in your home for 3 or 4 hours,
Mm-hmm.
and to make sure that person is engaging with their with their client or their patient is so important. So to help that person, stay independent and do the things that they enjoy doing instead of just,
You
sitting
said it
around.
earlier, you're inviting someone, and sometimes we're talking about 8, 10, 12 hours a day, right? So that match is crucial. It's an extension of their family. So finding that right person, it has to be very intentional. We would see so many times where it's like, there's a lot of companies out there that will just send a warm body, right? And the reality is I don't know how that's serving a good purpose.
It's not.
It's not.
It's not. But I
Right.
mean, those are the things. I think I think that when we're talking about doing your due diligence and those things, I think part of it too is being honest in
Right.
these interviews and when you're meeting with companies. There's a lot of times where you can see that they're holding back or maybe they don't want to say something. I'm of the mindset that if you don't want to say it in front of your loved one, that's fine. Send me an email, call me, text me, but tell me what I need to know. If you're looking for that, bull in a china shop, someone that's going to come in, take charge, find, just figure it out. That's important. If you sent someone to my home and they started rummaging through my cupboards to find where the trash was to take it out, I would be very off put by that.
Right.
I would think that's an invasion of my privacy. But I have one client and literally the only thing that he always says to me, Susan, I just want someone to come in here and find where the trash is. And I'm like, oh my gosh. And I always say to him, my gosh, if someone did that in my home, I would be like so off put. So I think it's having that conversation. What do you like? What do you not like? But share that, if you like a chatty Cathy or you don't want a chatty Cathy, those things matter. But I think people don't think about that when they're thinking about bringing care, and they think about the schedule or the care needs. But there's really a big picture. But I do think that there's that responsibility on the family.
So when you are in the selection process and you're meeting with the agency and you're having that living room visit, can you be very specific on who you want and the type of person and male, female, et cetera?
I think the more specific you are in that initial interview, the better outcome you're going to have, and I think, let's just be very honest. Majority of the time, the person who's calling the home care company is not the care recipient, right? It's usually the daughter, son, spouse saying, I need help for X. And really, it's always better to have multiple parties at that assessment to really unpack what's really going on. Because let's be honest, no one wants to admit that they need help, right? So it's like really getting a good picture and then again, expressing what your wishes are. If it's someone who's really only going to do good with males, then it's something that you should be putting on the forefront. If not, it's going to lead to them not sending a mail and then resentment builds. And then you just like, this isn't working. Well, I think you just have to be very honest and open on the front end, but also have realistic expectations too.
Yeah. Expectations are key, but being honest and sharing that. I would rather someone tell me today their wish list, however long it is,
right,
and me be able to have an honest conversation back with them about expectations versus them say nothing and then I send someone and that person rummages through their cupboards and they throw them out the front door like I would.
Right.
So like I know, our theme is being, proactive and planning ahead. So when can someone start doing this process and not be in this crisis mode and start opening the phone book and say, oh my God, who am I going to find?
Right.
The phone book. Does anybody here have a phone book, Bruce?
The yellow pages, right?
The blue book.
Yeah, the blue book.
That's right.
Thank you. That's
Yeah.
better.
There
Get
you
rid of
go.
the yellow one. Get the blue one.
And Bruce, I love your quote that you've had for years and years and years of being prepared and being 5 years too early than 5 minutes too late. And there's just so much to be said about that, right? I think the reality is I think once you start to see, it's not the person who needs the care is going to see it, right? It's usually that spouse, the person who's in the home every single day and saying, well, now I'm helping my husband. I have to really keep an eye on him when he's showering, or we're starting to see some cognitive decline. These are all things that once you start seeing those triggers, those warning flags, you need to start taking action, right? I mean, and sometimes it could be uncomfortable conversations because again, remember that person who's receiving care isn't admitting that they need care yet. But I think when the family has an overall discussion of saying, hey, like, we just have to have a plan in place for the future, it always goes so much smoother because the expectations are set, it's met. You already have an understanding of what company you're going to be calling or what direction you're going to be going down. And I'll tell you this, as being in the home care world, it was so encouraging sitting down with the family prior to, the crisis. Because I'll tell you this, on Friday at 5 o'clock, like, it happens, right? Someone's getting discharged from the hospital. They need care that given night. And everyone, that we're getting paperwork signed, we're sending e-documents across the country. I mean, it's just chaotic.
Yeah.
And at the end of the day, you're not able, because of the time constraints, to do your due diligence to make sure that you're finding the right person. Then you have to kind of backtrack and reset.
So somebody, even though they don't need care, they can do all their due diligence and do all the interviewing 5 years early.
That's right.
And then the home health care agency can have a little file, and they know who you are. They know your dog's name. They know everything about you early on.
Yeah. Actually, I designed some collateral back in the day. Actually, it was a piece that we called peace of mind, and it was just that, let's meet, let's get together, let's just establish some connection, so you don't feel like you're in a crisis matter when that time comes. And we would put their information on file, and obviously at that point there's no care needs, so it was just like very basic information, but it gave them peace of mind that they already had that next step to go to.
Like,
Great.
they met you, they got to see the face,
Right.
like they know there's something to it versus crisis mode. Like, that's just another person on the end of the call, and at that point it's frankly whoever answered the call.
That's right.
But yeah, I have the sweetest lady. She lives in Bonita, and my gosh, I'd have to look back. I would say we're probably going on 7 years. Every September she calls and we do this. We just talk, we catch up. How's it been the last year? She comes down for season, and she solely just wants to be active in my system. God forbid something should happen to her. Her husband has Parkinson's, and
Right.
we've never had to provide care, but every year she calls, and I love that because she knows, and her biggest fear is, what if I get in a car accident?
Right.
I now know I'm going to heaven in peace of mind that he's going to be taken care of because I've met you, I know you, and people can do that. I don't care if you call me now and you don't use me for 5 years.
That's right. We talked about statistics earlier, and I think it's worth mentioning the statistic of caregivers that are caring for someone who is the quote unquote sick person. The fact of the matter is those people are really at jeopardy, right? Because of the caregiver burnout, the stress, their health starts to decline. And then what happens, right? So, when we talk about being prepared, no one thinks about the person who's helping the spouse, right? But you really should, because there's an alarming statistic that those people, the family caregiver, actually health declines in some cases faster than the quote unquote sick person.
I think the person who's actually really bringing this statistic like nationwide and giving it a lot of light is Bruce Willis's current wife. I think her name's Emma, forgive me. But I mean, that really came out of nowhere with him.
Right.
And, she's really shed that. And she's taken a lot of heat for people saying, oh, well, you went on vacation and you do things. But there has to be this respite for the person taking the caregiver, because you're doing all the things you need to live. Then you're raising a family, but you're also the chauffeur,
Right.
the chef, the maid. Those things take a toll. And I love that recently there's been such a push and a drive to support the family caregiver because they need it. And the statistics are alarming about them passing away or getting illness or then needing care themselves. And what are you doing? It's so sad.
That's a good point. So, Adam, I know this isn't on our list of questions,
Yeah.
but this came to my mind, about transitional care.
Mhm.
So, because a lot of times people think, okay, I have home care and then I move into senior community and, it's black and white, but it really isn't, is it?
No, no. And we found a good opportunity years ago of understanding the benefits of transitional care. And I'll elaborate a little bit more. So if you're at the process where you're having caregivers come into your home, and helping out, and the family at some point understands that this is just not sustainable, mom or dad is going to transition to a senior living community, you have to also understand you've had a caregiver in the home for however long, and that's been a constant, right? And that's been a comfortable, environment. That's a familiar face. When we're talking about transitioning into a senior living community like assisted living or memory care, some of those transitions can be difficult, right? A new environment is hard for really anybody, but now we're talking about seniors specifically, and sometimes even more severe when someone has a cognitive impairment. New environments can be very, very challenging. So, presenting that type of transitional care where there is that constant, that familiar caregiver that they're used to having, really presents a good opportunity to make that transition as smooth as possible. So we really encourage that when we knew families were going to make that shift to that transition, and the families would contact us and say, we're gonna postpone services. We would always just like have a sit down conversation with them and say, hey, we've seen great success in having, Susie, your caregiver, who's been with you for the past 2 or 3 years, helping mom move. You start making it part of the process, right? Susie, the caregiver, is going to help with the packing and, starting to get, some of these things and getting mom excited about that transition, because that transition could be scary to her, and then when that move first, happens, Susie, that caregiver, is that connecting piece, that constant. And Susie's going to help mom find out where the dining hall is. Where does she check her mail, in the community? It's really about encouraging the transition, but also being that safety net and that comfortable environment. I believe so much in transitional care, and I hope that assisted living communities see just as a benefit, because it really does make transitions as smooth as possible.
Most of them do. The
Yeah.
good ones, the good
The
ones
good
do.
Right.
Yeah.
Right.
There's definitely. I think tying that kind of into the next question that I have is when people have home care come into the home, there's always often other services involved to some degree, whether that is Medicare home health, or maybe you have physical therapy, from an outpatient source, or you are transitioning into a community, or maybe you live in a community and you're retaining that one-on-one care. What can families or spouses expect in terms of how home care is working with those other care providers, expectations, and what should the family do to facilitate that?
I think it all comes back to good communication. I've said this for years, and I shed some light on it before. Like, there's too many situations where clinicians are not talking to each other. I think if you're having multiple disciplinaries coming into the home and supporting, communication is key. Understanding what's going on, making sure the left, hand knows what the right hand is doing. In the same situation of like when you have home care coming in with a certified nursing assistant, and then you have home health coming in from the skilled, medical home health perspective. When we're seeing changes in condition on the home care part, like the nurses and the in-home rehab team need to know about these changes, because it's for the better care of the actual client. So I think it just goes back to making sure that all parties have good communication, expectations are being set across the board, and understanding who's doing what, but then how is this communication being filtered, and what family members need to know what, right? I think that's a whole other thing that we could probably touch on is sometimes we're dealing with family members who have 3 or 4 or 5 kids and they're living all across the nation. Understanding kind of like the playbook, who's taking care of what, where does this information need to be provided. But I think making sure that collaboration, don't forget keeping the patient in mind always.
And it's interesting because when I started off talking about everyone has a baseline, And when things start to change on that baseline, having that your team of people being able, communicating with that team and that team communicating with your family or everybody involved is so important.
It is. Absolutely.
Definitely. So kind of taking this all, what is, one piece of advice you would say for our listeners on the home care topic that is like the most important?
Yeah. I said it earlier, when you're looking for the right fit, making sure that you're asking the right questions, and doing your due diligence. I mean, this should not be so transactional. Really understanding what that company represents, how do they make sure you're going to their website, making sure that they portray themselves and they're professional, making sure you're looking at their reviews, their testimonies. Now, don't just look at their testimonies on their websites, because let's be honest, you need to look around. You need to be making sure they're, and asking around too. The best type of referral for me back when I was in the industry was when someone would be word of mouth. And I mean that wholeheartedly. And sometimes that's kind of hard to understand, like from being a marketing and sales person, but there's no joke. That means that someone felt comfortable enough to put their word that we took care of their mom or dad or their spouse or themselves well enough that they would say that we're a good company to work with. So one word of advice is just to be very diligent in making sure that you're doing your homework, you're asking the right questions, and you're taking time to really find the right company. I can't stress that enough. And the only way you truly can do that, and I mean this wholeheartedly, is by planning for the crisis, not operating in the crisis, because they're two totally different things.
Absolutely.
It's good information. So I know, Susan's a statistic person, a stat person, but I'm a numbers guy. And so can you share with us, for their listeners, what is the cost and what should people expect with pricing?
Yeah. So right now, I mean, we're seeing in Florida, it's kind of different, and this is also something to mention. So if you're a listener and you're in the Northeast or in Ohio or in California, you might see a variation of prices. So I'll speak specifically to our area here in Florida, but then I'll also speak on a nationwide. Here in Southwest Florida, we're seeing ranges anywhere from $30 to $37 an hour. And I know that might sound like a wide range, but you're seeing variation of how many hours you're having per day. What's the care needs? Our model was more of like an all-inclusive, so we didn't have variation depending on level of care, but there are some companies that pricing does vary depending on the level of care. If you need, more of hands-on and showers and more in-depth care, it might be a little bit more than just your traditional companionship. So and you also see variation depending on how frequent the person is going to need care. If someone's 24 hours a day, that's 168 hours in a week. So the price might be discounted slightly, but that's generally what we're seeing on a nationwide basis. Again, it's important to understand where you are. You can go in Ohio and you could see costs as low as $20 an hour. Or you can go to New York and California and see care in the 50s and 60s. No joke. I mean, I work primarily today. About 85% of my clients are home care owners across the nation. So I have good statistics around that. So you'll see variation across the nation, but we're seeing here in Florida around mid-30s.
So if someone needed just a CNA, that's X number of dollars. But if they needed an RN, I'm sure that would be more expensive.
Yeah, and it's important to notate that I would say majority of the companies here in Southwest Florida do not provide private skilled care, right? So you have to also do your due diligence and homework to making sure that, when you're calling an agency and you have a need for skilled level care that requires medication management or IV therapy or wound care on a private pay basis that's not being covered by Medicare, you need to make sure that you're calling the right company. A lot of companies do not provide skilled care here in Southwest Florida.
The last time I checked, there's 6 of us.
Really?
Is that it?
That's it?
There's over 100 home care
Home care
agencies,
agents, right.
registered, all the. So, I mean, and that's the thing, like from the business perspective, like I know clients have choices, but it's about, making sure that you give the best that you can give, because there are a lot of choices. I've seen in the last 5 years, it's kind of like whack-a-mole. A new one's popping up
Oh,
every, I mean, it's
it's
all the time.
true.
And then, a year goes by too, and they're not in it. You saw a lot of people come from the Northeast. I think that they thought this was kind of a gold mine for them, and they didn't realize that starting it up, you're on call 24/7. There's all
That's
these
right.
components. So there's a ton of options. But when it comes down to having the skilled component of an LPN or an RN on staff, the last time I checked, and I do this pretty regularly, there was just 6 of us.
Wow.
Of agencies.
Right.
There were registry ones, but agencies just 6, and that it causes me pause for concern at times, because I'm very passionate about medication management, and we touched on it earlier. Medicare is not going to come out and fill your meds ongoing.
No.
So that's not happening. So let's rule that out. If you need your meds managed, you're hiring a nurse, an LPN or an RN to do that. And realistically, there's 6 options if you're going home care agency route.
Right.
It's scary.
Interesting.
And a nurse to come out on an average basis can range anywhere from $60 to $125 an hour. I mean, depending on the frequency and stuff like that. So, yeah, I mean, you look at the industry, cost has significantly gone up from when I entered the industry in 2010, I believe, 2010 and 11. When I entered the industry 10, 12, 13 years ago, the average cost of home care was like $21, $22 an hour, and now you fast forward and you're like, well, we're in the mid 30s, but it's also relative to everything. You go to the grocery store and we're paying 30, 40, 50% more. So,
well, you're going to fill your car up with gas to drive somewhere. And yeah,
that's right.
When I started, it was 20, 21 an hour. And I remember back then thinking 25. Oh my gosh.
Right.
Yeah. And then you're in the low 30s now, but it is, the pandemic, I think, played a part in escalating that. There was a lot of that, money that was given, and, it inflated pay wages and different things that I think played a part in it. But it's, I mean, you go to Publix, and the days of going to Publix and getting dinner for $40, that's gone. You're going and it's 100.
So
Right.
here's a question for both of you all about staffing. Is that an issue in Southwest Florida?
It's interesting. I mean, I've been in this industry for a little bit over a decade, I said, and I've seen waves, right? Waves of influx of hiring being a challenge and then not being a challenge. I would say in the past 5 years, it's still somewhat challenging. I think COVID certainly did not help the situation. And to be quite frank, when you look at pay wages, and you can go make $15, $16, $18 an hour at Target or Starbucks, you do that, or you're going to go, work in a somewhat considered to be challenging environment of helping people with showers and stuff like that. So I think that's where you come down to is the days of just like, I truly look at recruiting as just as much competition as getting business, right? Because you're really you're trying to present your company as the best place to work. So when you're looking at it from that perspective, is like, what are the factors that you're putting onto the table to be the best place to work?
Yeah.
And I think we, as an industry, unfortunately went through this phase of like, well, I'm going to pay $1 more. I'm going to pay $1 more. And all of a sudden that employee now has now that it's driven the cost of care to go up. But no longer are you just competing with that certified nursing assistant to go work at another agency or go work at a hospital or doctor's office. Some of those certified nursing assistants are saying, I can go serve coffee and make more money. So I think that's the challenge and so many people don't understand is CNAs and home health aides are leaving their profession to go make more money doing jobs that are not traditional to what they truly really want to do.
Interesting.
Well said. I mean, I think you're absolutely right. It comes and goes in waves. I think that there was this pay thing that, I'll pay more, and then you've outpaid them.
That's
I mean, you think back to 10 years ago, what was an LPN making in this type of space? And now CNAs are kind of demanding that. LPNs are demanding what RNs used to get. And yes, times change and things increase and there's a need for that. But it got escalated, I think, very rapidly in a few years span. But back in the day, and I would say like it's like pre-pandemic, I would say my competition for hiring was Adam. Okay. Now my competition for hiring is Walmart, McDonald's,
Uber.
Starbucks, Uber. Yeah. All these other things that offer that same thing. And I find myself having to say back to the caregiver, I understand that Target is telling you that it's $20 an hour, but how many shifts a week are they giving you? Like, I can advertise whatever I want, but if I don't hire you, it's that. But I think that there's still enough people in the industry where we can be selective. But your competition is definitely different than what it used to be because you are competing with things that are not in your industry anymore.
And I also think it's important to turn the tables of saying like, yeah, but how fulfilling is it to pour a cup of coffee?
Right.
Right. If you're looking at a career path and looking at a company that you have upward growth opportunities, like, let's talk about that. Right. And again, kind of like fulfilling that why did I get into home care is to really help other people. I don't know if you're going to get that being an Uber driver.
You're not.
No.
I mean,
That's a good point.
So,
and that's very important.
So, we would actually, quite frankly, on the other side of it is look at non-traditional home care, or employees and give them the tools and resources of maybe entering in, there's someone who is pouring coffee at a Starbucks saying, this isn't doing it for me. This isn't my long-term goal. Well, looking at that person as an opportunity is saying like, hey, like we could put you through a CNA school. We can mold you. And honestly, those people were the best because you get to, really present them to be the best that they can be.
Adam, this is great information.
Yeah.
It's wonderful. If people wanted to reach out to you, if they wanted to talk to you about home care or talk to you about elevation marketing, how can they reach you?
Yeah, they can reach me directly on my email. It's adam@elevationmktg.com. Or call me on my cell phone, truly, 732-300-4758. I have such a passion for this industry. Although I pivoted a little bit, I still am passionate about staying in this industry and helping home care agencies across the nation with their marketing. But I still get to have that end result of good companies providing great care.
Yeah, and you're on the journey with us. I think that's that's what I love is that maybe you're not running a home care company, but you're contributing, I think, in ways that maybe you don't even realize. And I think what's such a blessing for you is that your reach is far beyond Southwest Florida. I mean, you're touching people in California and Ohio and everywhere in between. And I think the more people that could have a little Adam sprinkled in their senior living is a blessing to them.
Well, thank you. I appreciate you saying that.
I know we have some guests today. Would we like to introduce our guest?
Sure.
Bring them on.
You want to come say hi?
Come say
They've
hello.
been great today.
I have my little 7-year-old twins, Kenzie and Carter. You can come over. Just be careful.
They're adorable. I love that she's representing.
This is Kenzie, our Chief Creative Officer, right? She's wearing elevation marketing.
I love it.
And this is Carter. They're 7-year-old twins.
You guys, this is a first for us. So
you're our first
Special
twin little
guest.
CEOs.
First twins here in the studio. It's very exciting. They're going into second grade starting next week, so they're very excited at Big Cypress Elementary. So
I hope you guys had a fun summer.
Well, thank you for having me.
Thank
and
you.
Honestly,
Thank
it means a lot. And anything I can do to continue to support you both, I think what you're doing is truly amazing. Providing this education, not just for Southwest Florida, but for everywhere, is something special.
Thank you.
Thank you. It means so much to have you with us today. And I love that you brought the kids and that they get to see this because that is the future generation of who knows what.
That's right.
Thank you so much.
When experience matters the most, Senior Housing Solutions uses over 30 years of industry knowledge to provide expert advice for those considering a move to a senior living community. We are the matchmakers of senior housing. Call today at 239-595-0207 for your free consultation.
Welcome to Checkmate. Well, today, as we wrap up the episode, I just think this was such a great episode. Obviously, it's full of everything I love, which is in-home care. So would love to have a takeaway from you.
It's just so great seeing Adam and getting his insight. But I think, the idea of being proactive, just resonates. It just totally resonates with everything that I say and everything that we do.
Yeah.
So, being proactive, doing your due diligence early on, so important. And, understanding, when he's talking about the different numbers of different, between the different, from an agency to registry, you gotta do that. And you gotta know something because, you are inviting somebody in your home to take care of your loved one. And that's pretty serious stuff. And so you gotta do your due diligence early on.
Yeah, I loved, I think we could have sat here and gone on for days. I certainly know I could. I'm a nerd on this topic. But there were so many things I think that were just so important. I really love your message that like you're inviting them into your home, into your life, and you need to, be open and be honest and have those expectations, and communication is so important because if you don't set it up right, I feel like you can get a bad taste in your mouth and then you are in more denial.
Right.
But really doing it the right way and having a good experience can be a life-changing event.
That's right. Absolutely.
So thank you so much for being with us.
Thank you.
Bruce, did you want to say thank you?
I think that goes with what you said.
I can't read my notes, so I don't really know where we're at.
You.
I know that next I have to talk about the next episode.
Yeah, let's do
that. So
that.
That's where I'm at?
Let's do that.
Okay, let's. Okay. So next week, I'm really excited. While we dove this week into home care, next week we're going to dive into senior living communities, which is your arena. And I'm very excited. We have a colleague that you know in the community, Bill Diamond. He is the executive director with the Carlisle.
Yes.
So next week, we're going to be diving into your world. And let me tell you, Bruce, I have some tough questions.
That's good. It's hard for me to bite my tongue because I probably would want to do the whole episode myself. So it's very hard for me to, have somebody else do it. But Bill is great.
Yeah.
He's going to be a great guest for us, and he's very knowledgeable, has a lot of experience, and being an executive director, I always say there's the sales side of senior living and there's the operational side, and it's sort of like the dark side of the operational side. So I'm sure he's gonna give a lot of insight into the operational side of senior living.
I'm really excited. I'm a big proponent of staying in your lane. I think that as professionals in healthcare, we all know our specific industries, but we also do know other industries. Obviously, I think I could speak semi-intelligently about facilities, but I'm certainly not someone you should take advice to. So I love that we're constantly encouraging people to get that advice, that feedback, that quality information from the true expert, not, your buddy on the golf course or not your home care agency. Because while I love it and I know it, I don't know it the best. So I'm excited to pick the brain of another expert.
So we're going to leave our listeners with a question.
Ooh.
So this is a good question. So if you were going to consider moving to a senior living community, what features would be important to you?
Oh.
So, think about that. So if you were at whatever point that is in your life and you're going to move to a senior living community, what would be important to you? What features? And more than, I want a 2-bedroom, I want this, what features of that community would be important to you?
Oh, I love it. And that's a great thing for our listeners to think about for next week. And I'm actually going to answer that in our opening segment next week for myself.
Okay.
You've given me some homework. Well,
looking forward to it.
Thank you for joining us. Thank you for listening to our first episode of season 2. Super excited to bring all of our great guests we have this season. And until we talk to you next week, have a great week.
Be sure to subscribe to our podcast and follow us on social media. You can also find more information and resources at www.theaginggamepodcast.com.